Hello students, how are you? In this video I'm going to discuss posterior triangle of the neck. The neck has been divided into two main regions, anterior cervical region and posterior cervical region, by means of a very broad and strap-like muscle which is called sternocleidomastoid muscle. Here you can look at the sternocleidomastoid muscle. Anterior to this muscle we have got anterior triangle, and posterior to it we have got posterior triangle of the neck. So as we said that these are triangles, but before going into the details of the triangles, it's better that we should understand the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle. This name appears to be very difficult as it is long enough, but actually it is not. It is very simple to understand the muscle. Rather, this name would help you, give you clue to remember the origin and insertion of the muscles of this muscle. For example, it has got word sterno and cleido in its name. So sterno means it has got one head arising from the sternum and it is rounded head. The other is cleido. Cleido is from the word clavicle. So medial third of the clavicle, superior surface of the clavicle. So sternal head and clavicular head. These two heads move upward and backward and join together to attached onto the mastoid process of the occipital bone. Sorry, temporal bone, occipital process of the temporal bone. So here we have got sternocleido and mastoid. So sterno and cleido for the origin of the muscle, and mastoid for the insertion of the muscle. So this muscle has got, this strap-like muscle is very much visible in thin lean people as they turn their head towards one side. So this muscle has got anterior border here and it has got posterior border. So this muscle plays a very important, vital and key role in the division of the neck. Anterior to this muscle we have got anterior triangle, and posterior to this neck we have got this muscle we have got posterior triangle of the neck. So again, posterior triangle of the neck lies between the posterior border of the sternocleidomastoid muscle. Here its posterior border. Here we have got another muscle which is trapezius muscle. This muscle is superficial muscle of the back, and this muscle attaches the upper limb to the vertebral column, or axiopendicular muscle, posterior axiopendicular muscle. So it has got anterior border. So this triangle lies between the posterior border of the sternocleidomastoid and anterior border of the trapezius muscle here. Then we have got a base. Like any triangle means it is a geometrical shape which has got base and apex and borders as well. So base is being formed by the clavicle. Here you can see clavicle has been divided into three parts: medial third, middle third, and lateral third. So out of these three parts, only middle third is forming the base of this triangle. Here you can see. And apex is being formed by the convergence of the anterior border and posterior border here at the superior knuckle line. So this triangle is very much has been highlighted with the help of yellow color. So this is the triangle which is called the posterior triangle, and it has got many other muscles as well, which are forming the base, floor of the triangle. Floor of the triangle is being formed by this splenius capitis muscle. Then we have got levator scapulae. Then we have got here scalene posterior, scalene medial, and scalene anterior muscle. We will look into the details detail of these muscles, especially scalene muscles, so you would have better understanding what is actually happening deeper with these structures. So before that, I would go for another muscle which is called omohyoid muscle. Omohyoid muscle. Here you can see omohyoid muscle. It has got two bellies: inferior belly and superior belly, and then intermediate tendon. So in a while I would be going to the omohyoid muscle. So here. This muscle is called omohyoid muscle. Omohyoid. It has again, it has got two parts in its name. Word omo and hyoid. Omo is for scapula. This is scapula shoulder blade bone. It has got superior border. This is suprascapular notch. It has got notch in its upper border. So just adjacent to that notch, inferior belly of omohyoid arises behind this clavicle bone. Here you can see. Then it has got intermediate tendon. Then it has got superior belly, which attaches onto the hyoid bone. This is the reason this bone has been named as omohyoid muscle. Omohyoid muscle with intermediate tendon. So again, in this particular diagram here, you can see this muscle. This is inferior belly of omohyoid. Scapula is under this trapezius muscle. It has been concealed by this trapezius muscle. So inferior belly attached to the superior border of the scapula, then intermediate tendon, then superior belly attaches to the hyoid bone. So this is the reason this muscle has been named as omohyoid muscle. So again, I would like to go to our first diagram. Okay. Rather, I would move towards another diagram which is of better quality, so I can zoom in and zoom out as well. So this is inferior belly of omohyoid, and this is superior belly of omohyoid, and intermediate tendon has been covered by this sternocleidomastoid muscle. So this inferior belly of omohyoid divides this triangle, posterior triangle, into two further triangles. One, this very small triangle you can see. This very smaller triangle. And then the bigger triangle, this rest of the triangle. Rest of the posterior triangle. So again, this posterior triangle has been divided into further two triangles, very smaller one. This is called omoclavicular triangle. This small triangle is called omoclavicular triangle. Why omoclavicular triangle? Because it is present between this triangle is present between the inferior belly of omohyoid muscle and clavicle. This is called omoclavicular triangle. It has got another name. It is called subclavian triangle. Why? Because the subclavian artery, which is its third part, is lying deep within this triangle. So this is also called subclavian, and it is also called supraclavicular triangle because it is present just above the scapula. So the boundaries of omoclavicular triangle or supraclavicular triangle are subclavian triangles are superiorly it is bounded by the inferior border of the inferior belly of the omohyoid, and inferiorly it is bounded by the clavicle mid shaft, and anteriorly it is bounded by the posterior border of the sternocleidomastoid muscle, this smaller triangle. And rest of the bigger triangle is this occipital triangle. Rest of the posterior triangle. Boundaries of occipital triangle are more or less same except for the base. Here base is being formed by the superior border of the inferior belly of the omohyoid muscle. Here it has got two borders, superior border and inferior border, omohyoid muscle. So superior border of the inferior belly of omohyoid muscle forms the base of the occipital triangle. Then anterior border is being formed by the posterior border of the sternocleidomastoid, and posteriorly it is bounded by the anterior border of the trapezius muscle. Here this is called occipital triangle because here occipital artery from here at the apex emerges beneath these muscles and supplies the scalp, so that's why it is named as occipital triangle. And here we have got same splenius muscle, then levator scapulae, then scalene, posterior, medial, anterior, and here we have got brachial plexus emerging out of these two structures. So as I promised, I'm going to show you scalene muscles. These are scalene muscles. At one end they are attached to the vertebral column, and at the other end they are attached to the ribs. They are three in number: anterior scalene, middle scalene, and posterior scalene. And between anterior and middle scalene we have got brachial plexus coming out and subclavian artery. Brachial plexus is going to supply the muscles of the upper limb. It would result into C5, 6, 7, 8, T1 root values. They enter into the, beneath the clavicle bone into the axilla, and from axilla they result into the formation of nerves, axillary nerve, radial nerve, ulnar nerve, median nerve. So most of the students who are familiar, MBBS students who are familiar with upper limb, they know what I'm talking about. But for the BDS students who don't have any idea about the upper limb and its nerve supply and its structures, so this is, brachial plexus. Brachial plexus will come out of it is a spinal nerve. These are spinal nerves: C5, 6, 7, 8, and T1 spinal nerve. They are coming out and forming a plexus. This plexus is going to supply the muscles and structures of the upper limb. So this was the posterior triangle, its boundaries and its structures. For contents, I think I'm going to, it needs another dedicated video for contents, which this video is just about the boundaries. Okay, thank you very much. God bless you.